I'm going to talk about trigger finger today, and what that involves is individuals having pain here in the palm, and also causes swelling on the tendon. And sometimes the finger does lock up, and that's what they call a trigger finger, because the finger locks up like you're holding a gun of some sort and has a trigger lock. So let's talk a little bit about trigger finger, what it is and what it entails. Usually you have a tendon that normally looks nice and thin like that. Unfortunately, because of work, activity, medications, daily activities that you do, trauma, you develop these little knots, these little swellings there in the area of the tendon. Now what happens is that mechanism of the tendon has to flip back and forth across that sheath. That causes inflammation, causes tenderness, and then causes that finger to lock up on you. And usually what happens is the tendon runs right across from the fingertip all the way up to the palm. And when there's a little knot, it gets locked on that sheath and locks up on the finger. And that tendon does runs along around that tendon there across the bone. And causes, sometimes people describe it as bone pain, sometimes I have arthritis, but normally that's what it is tendon pain from the trigger finger. Now, how do we treat this? Well, there's different ways to treat it. You can treat it with medications. We can try Celebrex, ibuprofen, and Levetana, which are non-steroidals to kind of help decrease inflammation here in the palm. Also, we can give steroid pills to kind of help to decrease the inflammation around that area of the tendon and tendon sheath to kind of help with that improvement of the hand. The other things that we can do is do steroid injections. Do a steroid injection there in the area of the palm where the finger that's having the issue to decrease that inflammation, and the majority of these people do pretty good. Now, if none of these methods work, then we can also do surgery. Different methods that we can do for surgery is we do open or endoscopic. Both of them are perfectly fine. Open technique, it's a centimeter or 2 centimeter incision here in the palm. You release it, get the compression off the tendon to release that compression, and then close it back up. And the patients have a soft dressing for about a week, and patients can start using their hand the minute they walk out of the OR with the open technique. Endoscopically, the same thing. The only difference is the incisions are smaller, and you can make those incisions here at the palm area as well. Afterward, you're in a soft dressing that's on there for a week. That comes off. You have no restrictions as well. The minute you walk out of the OR, you can start using your hand right away. Different ways to diagnose it. We use an ultrasound machine and also a physical exam to examine your hand and see if that's the problem. Now, if you have any other questions or concerns, reach out to us. At our office is 972-939-4974. And our website is www.loredohands.com, Loredo hands.com. Thank you.